These small tendons around the shoulder are called the rotator cuff. And those muscles and tendons lift and reach and raise and clean the window.
Okay.
And what your MRI shows is the top tendon here that raises and lifts your arm has torn.
Oh, shit.
So it's detached from the bone.
Oh, well, no wonder it hurts.
Correct. And then the things that you're talking about, raising your arm, lowering your arm, getting a gallon of milk out of the fridge, all of that requires using your rotator cuff. And if you're using and pulling on a tear, that's painful.
Real painful.
And the clicking and popping is pretty much the tear.
There's a fix for it?
Well, there are treatments for it. The pain you're feeling here down the arm is very classic rotator cuff pain. So even though you feel pain here, it truly is a shoulder issue.
Okay.
It's hard to know, either based on your history or the look of the MRI, when exactly this happened. Was it the tennis? I doubt it was the meningitis as a youngster. That doesn't lead to a structural tear of a tendon. But the motorcycle wreck, I mean, anything. Or it could have been progressive with time.
Or the scar tissue could have just bound all the stuff in there so that when I did extend and use it, it wasn't quite as malleable and pliable or something.
Sure.
Who knows? I guess it doesn't really matter.
Well, it matters in the sense that sometimes an old chronic tear that happened 30 years ago can progress to the point where it just becomes irreparable. So the worst case scenario you don't have, which would be that it tore in your 20s and it's no longer fixable. So you don't have that situation.
Okay, should I turn this off now? Sorry.
That's up to you.
I don't know what you're going to say next. I'm scared.
So the rotate, once that tendon tears, the body's not good at repairing it back. So there are non-surgical treatments for your shoulder and surgical treatments for your shoulder. Non-surgical are directed toward getting the shoulder to try to calm down, reduce pain, and compensate for the tear. So those tendons and muscles that are still connected and functional, can we get the shoulder to calm down and get them to do more than their share of the load and get you to a happy place
Be a
non-surgically?
compensatory thing.
Can they compensate?
I've tried that.
Yeah.
I've been really, exerting.
So you can modify activity, anti-inflammatory measures like ice or Advil, or sometimes even a shot, can reduce pain and inflammation. Physical therapy can work on motion and strengthening, although it's hard to do therapy when you're in pretty severe pain.
It is.
And then
I should probably talk about the surgical potential.
So the surgical approach means repairing the tendon, taking the torn tendon and reattaching it to the bone.
And that's possible.
Yes.